Bladder cancer, often described as a silent condition in its early stages, can present with subtle symptoms that are easily overlooked or mistaken for other common urinary issues. This quiet onset is one reason why many cases are detected only after the cancer has progressed. However, being aware of the early warning signs can make a significant difference in outcomes, as early diagnosis can lead to more successful treatments and improved quality of life. At the heart of early bladder cancer detection is a symptom that is both common and often misunderstood: blood in the urine. Medically referred to as hematuria, this symptom can be alarming when noticed, but it can also go undetected if the blood is present only in microscopic amounts. When blood is visible, it can range in color from light pink to deep red or even brown, resembling tea or cola. This variability in appearance depends on how long the blood has been in the bladder or urinary tract and how much is present. Hematuria is particularly tricky because it doesn't always accompany other discomforts. Many people with bladder cancer will notice blood in their urine without feeling any pain or experiencing other issues. This can make it easy to dismiss, especially if the blood appears only intermittently. A person might see blood one day, then have clear urine for several days, leading them to believe the issue has resolved itself. However, this on and off pattern can be indicative of bladder cancer, and even a single instance of blood in the urine should prompt immediate medical attention. The presence of blood in the urine is not unique to bladder cancer. It can also be caused by other conditions, such as urinary tract infections, UTIs, kidney stones, or even trauma to the urinary system. However, bladder cancer remains a leading cause of unexplained hematuria, especially in older adults and individuals with risk factors such as smoking or chemical exposure. Smoking, in particular, significantly increases the risk of developing bladder cancer, as carcinogens from tobacco smoke are absorbed into the bloodstream and eventually filtered by the kidneys into the urine, where they can directly affect the bladder lining. Another early symptom of bladder cancer is an increase in urinary frequency or urgency. This often manifests as the need to urinate more frequently than usual, even if the bladder isn't full. Some individuals may also experience a sudden, urgent need to urinate that can be difficult to control. These changes in urinary habits are caused by irritation of the bladder wall, which can occur as the cancer cells begin to grow and multiply. Similar to hematuria, these urinary symptoms can be easily attributed to other more common conditions, particularly urinary tract infections. However, bladder cancer symptoms typically persist even after treatment for infections. For example, a person may be treated with antibiotics for what appears to be a recurring UTI, only to find that the symptoms continue. This persistence is a key red flag and should prompt further investigation, usually through urine tests, imaging, or cystoscopy, where a small camera is inserted into the bladder to look for abnormal growths. Painful or burning sensations during urination can also be an early sign of bladder cancer. While such pain is often associated with infections or inflammatory conditions, bladder cancer can cause similar discomfort as the cancer cells invade the bladder wall or block parts of the urinary tract. This pain may occur with every urination or intermittently, depending on the extent and location of the cancer. Unlike infections, however, the pain caused by bladder cancer is unlikely to resolve with standard treatments like antibiotics, reinforcing the importance of further investigation if the discomfort persists. As bladder cancer progresses, symptoms may become more severe or involve other parts of the body. In some cases, pain can extend to the pelvic region or lower back, particularly if the cancer spreads beyond the bladder and starts affecting nearby tissues or organs. This pain may be dull and constant or sharp and intermittent, depending on the extent of the tumor's growth. Additionally, advanced bladder cancer may cause more noticeable changes in urinary habits, such as difficulty starting urination or a weak urine stream, as the cancer obstructs the flow of urine from the bladder. The challenge with diagnosing bladder cancer early lies in the nonspecific nature of its initial symptoms. Many people may experience urinary changes at some point in their lives due to infections, kidney stones, or other benign conditions, making it difficult to differentiate between these issues and the onset of cancer. This is why awareness of the persistence and recurrence of symptoms is so crucial. If blood in the urine, pain during urination, or frequent urination continues over time or returns after treatment, further testing is essential to rule out serious underlying conditions like bladder cancer. One important tool in diagnosing bladder cancer is the urine cytology test, where a sample of urine is examined under a microscope to look for cancer cells. While not always conclusive, this test can provide important clues, particularly when combined with other diagnostic tools like imaging scans or a cystoscopy. In some cases, bladder cancer may be detected through routine urine tests done for other reasons, such as during a general checkup or while monitoring another health condition. This underscores the importance of regular health screenings, particularly for individuals at higher risk for bladder cancer, such as smokers or those with a family history of the disease. Imaging tests, such as ultrasounds, CT scans, or MRIs, can also play a role in diagnosing bladder cancer, particularly in more advanced stages where the tumor has grown large enough to be visible. These imaging tests can help determine the size and location of the tumor, as well as whether the cancer has spread to nearby lymph nodes or other organs. In some cases, a biopsy may be necessary to confirm the diagnosis, where a small sample of tissue is taken from the bladder for examination. The earlier bladder cancer is detected, the more treatment options are available, and the more likely it is that the cancer can be effectively managed or even cured. In the earliest stages, bladder cancer is typically confined to the inner lining of the bladder, known as the urothelium. At this stage, treatment may involve removing the tumor through a procedure called transurethral resection of bladder tumor, TURBT, where the tumor is scraped away using a special tool inserted through the urethra. Additional treatments, such as chemotherapy or immunotherapy, may be applied directly into the bladder to kill any remaining cancer cells and prevent recurrence. If the cancer has spread deeper into the bladder wall or to nearby tissues, more aggressive treatments may be required, including surgery to remove part or all of the bladder, along with chemotherapy, radiation, or systemic immunotherapy to target cancer cells throughout the body. While these treatments can be effective, they come with more significant side effects and may impact a person's quality of life, making early detection and intervention critical. Bladder cancer can also recur, even after successful treatment, which is why regular follow-up care is essential. Individuals who have been treated for bladder cancer typically undergo routine cystoscopies and urine tests to monitor for any signs of recurrence. This ongoing surveillance helps catch new tumors early when they are most treatable. In conclusion, bladder cancer is a complex disease that often begins with subtle symptoms like blood in the urine, frequent urination, or pain during urination. While these signs can be easily dismissed or attributed to other conditions, they should not be ignored, especially if they persist or recur. Awareness of the early symptoms, combined with prompt medical evaluation and testing, can lead to earlier diagnosis, more treatment options, and better long-term outcomes. For those at higher risk, such as smokers or individuals with a family history of bladder cancer, regular checkups and open communication with healthcare providers are key to catching this silent disease before it progresses. That wraps up our deep dive into the early symptoms of bladder cancer. Remember, paying attention to your body and recognizing the warning signs, like blood in the urine, frequent urination, or pain during urination, can make all the difference. If you or someone you know is experiencing any of these symptoms, it's important to consult a healthcare professional as soon as possible. Early detection can lead to better outcomes and potentially save lives. Thanks for watching. If you found this video helpful, please give it a thumbs up, subscribe for more health-related content, and hit the notification bell so you don't miss any updates. Stay informed, stay healthy, and take care.